Mhm.
Good evening or good morning or whatever time it is when you get to view this. I am here with my friend and extraordinary researcher, Bob Miller, who has taught me so much and from whom I continue to learn every single day. Last night, he gave an amazing presentation on the effect of electromagnetic frequencies and radiofrequency radiation and a possible pathway forward in terms of supporting the oxidative stress and some of the other phenomena in peroxynitrite, et cetera, that occur with radiofrequency radiation exposure. And this was all for the upcoming EMFM conference at the end of the month. I was blown away. Dr. Rena Bray, who was the moderator, who's been in this field for a long time, was also blown away. And so I believe that Bob has those slides, and if he is generous enough to share them with us, we are in luck. At any rate, this evening, or right now, we're going to be talking about metals, one of my favorite subjects, toxicant metals, and the relationship of SNPs and aberrant biochemistry to upregulation of IL-6. So I think we're all in for a treat.
Okay, well,
I'll take it.
Dr. Patrick, always a pleasure to chat with you. Thank you for those kind words. In regards to that EMF talk, the slides for that are going to be on the link that I'm going to give everybody. I'm going to give everyone an email. They can send an email to it. They'll get a link to a web page, and it'll have these slides, but it'll have that EMF slides as well. And if there is a link for that replay, if we have it, I might put that on this this website as well, so people can actually watch the lecture. It was a lot of fun. So, we're now going to start talking tonight about heavy metals, one of your favorite subjects, and also how does it impact something called interleukin 6, IL-6. And of course, you know, the disclaimer, this is for educational, informational purposes, and we're not saying that this diagnoses or treats a disease. Now, one of my favorite sayings is, this is a 3D chess game played underwater. And I actually had an artist draw this with the scuba divers here. And the reason I say that is because this is so complicated. You know, we can't find the pill for the ill, and I don't think we're going to find the SNP for the ill either. There's so many factors that come together. And I think this is why sometimes things have come up empty when people were looking for a genetic variant related to a disease, because I think we're going to find there isn't any. There might be some that might be loosely correlated, but it's a dance between many things that create more free radicals, inability to make antioxidants, and then all those environmental factors. If you're living in a house full of mold, if you're exposed to excess Wi-Fi, if you've been a smoker, if you've been exposed to a lot of chemicals, either petrochemicals or farm chemicals, and then if you have genetic mutations in some genes, it's a multifactorial. That's why I call it the 3D chess game played underwater. Now, I think most people listening to this know what interleukins and cytokines are, so I'm going to go through this pretty quickly. They're mediators involved between cells, particularly white blood cells, and they're a type of cytokine, and that's derived from the combination of two Greek words, cyto meaning cell, and kinos meaning movement. They're cell signaling molecules that aid cell-to-cell communication in immune responses and stimulate the movement of cells towards sites of inflammation, infection, and trauma. So these are good guys when they're used appropriately. And there's significant evidence showing that certain cytokines are involved in not only the initiation, but also the persistence of pathologic pain by directly averting sensory neurons. And they're also involved in nerve injury inflammation, induced central sensitization, and peripheral inflammatory responses. Now again, interleukin 6, this cytokine, it can be useful. Our immune system and white blood cells are critical, obviously, for protection against pathogens and development of infections. IL-6 is an essential messenger within the immune system. Acute inflammation signals for tissue repair, and this is, I think, particularly for burns, and inflammatory responses designed to initiate healing or protection against invaders. However, as we all know, unresolved chronic inflammation has been associated with many health concerns. And Dr. Patrick, you and I both know, as you know, in the original naturopathic philosophy, was that excessive inflammation is likely the root cause, because most of the things that's giving us issues today. Now, when they did total elimination of IL-6 in animals, it actually increased susceptibility to various infections. So bottom line is, IL-6 used appropriately is good and helpful. So here's a study that showed that they utilized APOE-induced arteriosclerosis mice to evaluate the impact of IL-6 on arteriosclerosis. When they didn't have that, they were found to have increased serum cholesterol, lesions, and enhanced plaque formation. And basal levels of IL-6 appears to be critical for that lipid regulation. Now, the beneficial effects mediated by exercise may be induced by IL-6 production. It appears to be released into the contracting muscles, and it may have a role in gastric functions in response to exercise. And they found that an IL-6 blockade.
This makes sense to me now that I am looking at some of my triathletes, and it's seeing that they have IL-6 elevation and not necessarily related to toxic exposure or chronic infection. I think it's as a result of that excessive, muscular function, that
Absolutely.
Yeah.
Yeah, absolutely. I mean, we need a little bit of exercise, obviously, but as you said, these triathlons or the people who do marathons, they can actually raise their inflammation by overdoing it. One of my favorite sayings is, everything we really need to learn, we learned with Goldilocks and the Three Bears. Not too hot, not too cold. We have to find that balance. There's a balance to everything. So bottom line is, IL-6 may have some beneficial roles within some conditions. However, we're going to look at the bad and the ugly. Now, this was an interesting study that was published all the way back in 2016. And this was looking at interleukin-6 and C-reactive protein, successful aging, mortality in this senior study. Now, what they were talking about was chronic low-grade inflammation, inflammaging. We all know that's a risk factor for development of age-related diseases and frailty. And they looked at several thousand Eastern Europeans aged 65 and older, and they were looking at interleukin-6 and C-reactive protein and how that was associated with physical and cognitive performance, and whether it could predict mortality in the successfully aging individuals. Huge study. Over here, I just put the cliff notes from it. When comparing successfully aging individuals to those with aging-related diseases and disability, there was lower IL-6 levels in the successfully aging group. Longer survival was associated with lower concentrations of IL-6 and C-reactive protein. So the conclusion of the study, I mean, it's a massive study, both IL-6 and CRP levels were good predictors of physical and cognitive performance and the risk of mortality in both the entire elderly population and in successfully aging individuals. Now, look at this statement here. Systemic inflammation predicts all-cause mortality. Now, that's a big claim. All-cause mortality in men from a 9-year follow-up study. Just highlighted one of the conclusions. IL-6 was consistently related to all-cause mortality, independent of the level of adjustment, and showing a dose-response relationship between IL-6 and risk of death. Study shows that IL-6 is a powerful predictor of all-cause mortality in male elderly community dwellings. Now, they were just looking at men. I would assume the same applies for women as well. Now, we're all concerned about COVID. And as we know, some people have had COVID. They were very surprised to learn they had it because they didn't even know they had it. Other people were saying, well, yeah, I had a cough and a sore throat, not too bad. Other people are gasping for breath on ventilators and dying. So there's a lot we need to learn about COVID, because bradykinin might be a piece of this as well. But during a meta-analysis and systemic review, elevated IL-6 levels were found to be significantly associated with adverse clinical outcomes. There was a reported 2.9-fold increase in mean IL-6 concentrations in complicated COVID-19 cases.
You know,
And
this is interesting, Bob, because I was just listening to Roger Sayholt. I don't know if you have heard him. He's a pulmonologist. He's actually quadruple board certified in pulmonology and sleep medicine and a few other things. And he was talking about how it really appears that in COVID now, the defining variable between progression to severe COVID and having a mild case or having no case at all is an inability to produce interferon. And I think that if we go a little bit further into, down the biochemical rabbit hole here, we'll see that the interleukin production really is a result of a downregulation of the T cells, Th1 specifically. So I'm waiting to hear about that, but now I'm really intrigued because we know biochemically how to upregulate interferon production, right, using supplements, et cetera, and how to downregulate interleukin-6. And I think that's a strategy.
Absolutely. We'll have to investigate that. We'll take a look at that, and maybe we can come back sometime and talk about that, or present some of that data at the conference. I'll have myself and my researchers will get on that, Dr. Patrick. That sounds quite fascinating. Now, here's another study. Evidence shows that pro-inflammatory cytokines play a pivotal role in the pathology of lung damage in patients affected by coronavirus 2019, caused by severe acute respiratory syndrome. A lot of patients affected by COVID-19 developing a damaging immune reaction sustained by cytokines. Interleukin-6 is one of the main mediators of that inflammatory and immune response. And levels of IL-6 seem to be associated with that inflammatory response, respiratory failure, needing for mechanical ventilation, and/or intubation, and mortality in the COVID-19 patients. Now, just a couple slides. Now, I have quite a few slides. And for time tonight, I'm only giving maybe like 25% of them. And what we did is I made up an appendix. And if somebody just goes to the website that I'm going to talk about later, they can download them all and look at all of them. But here we have conclusion. The data suggests that IL-6 may be actively involved in hypoxia-induced lung inflammation and pulmonary vascular remodeling in mice. So we're talking about interleukin-6 in pulmonary hypertension. Here's another one. The vascular IL-6 contributes to endothelial dysfunction. IL-6 is produced as a response to angiotensin II. IL-6 is associated with hypertension and a higher incidence of all-cause mortality. One of the things we'll show later is how IL-6 stimulates the NOx enzyme that makes mast cells and histamine. That comes back and stimulates renin, which then makes that angiotensin 1 and 2. And it's associated with higher incidence of all-cause mortality and increased superoxide. We're going to talk about that tonight, which combines with nitric oxide to create peroxynitrite, thus lowering nitric oxide bioavailability. And we all tend to think that nitric oxide is, the vasodilator, which it is, when it won the Nobel Prize. But we're learning it even has a down regulation on the NOx enzyme and mast cells. So again, back to that 3D chess game played underwater. We found this very interesting. Results provide further evidence that aberrant IL-6 may be associated with autism. Thus, increased IL-6 expression may be partially responsible for the pathology of autism. So again, we go back to that brain that's, that neuroinflammation. It would make sense that IL-6 could be a factor, at least, in some of that.
Absolutely. There's really good research that shows PM2.5, which is airborne particulate pollution, 2.5 microns and less, is correlated with the incidence and risk for autism. And for sure, particulate pollution increases IL-6 levels as well.
Absolutely. Yeah, it's one of the things we're going to be showing in one of our graphs, possibly, and again, this is totally speculative, possibly why COVID is being so serious in California because of all the forest fires.
Yeah,
That
Yeah, I've heard Dr. Zach Bush talk about that the virus actually can adhere to and be carried by particulate pollution.
absolutely, and the particulate pollution may be separately increasing the interleukin 6.
Absolutely.
Now, here's talking about anxiety. And, we were just talking before we recorded how everyone seems to be coming unglued. I mean, people are watching the news and we're just aghast at the way people are behaving. And it just seems like everyone's in this anxious state. This study showed that clinically anxious participants exhibited significantly lower levels of morning cortisol and higher levels of IL-6, independent of age, sex, and depressive symptoms. We all know that cortisol is needed for many functions, turns into cortisone, but is also needed to tamp down excess histamine, which I'll show in a little while, is a byproduct of elevated interleukin 6. Depressive disorder. Among those pro-inflammatory cytokines, animal studies and clinical studies have demonstrated that IL-6 may have a special role in the pathology and consequences of depressive disorder.
Mm-hmm.
Then suicidal behavior. Again, this is increasing. Elevated IL-6 was most robust cytokine finding associated with suicidal ideations in both non-fatal suicide attempts and actual suicides. And this was published back in 2016.
Mm-hmm.
Now, I have slides that talk about how there's a relationship between IL-6 and breast cancer, colon cancer, inflammatory bowel disease, Alzheimer's, pancreatic cancer, rheumatoid arthritis, and autoimmune disease in particular, type 2 diabetes, low thyroid, mast cell activation, hot flashes, anorexia, and vitiligo. And I have a sneaking suspicion we could easily double this list. So if somebody wants to see the studies, they're all in the appendix. They're all there just in the same format. But because of the length of time, I wanted to talk about heavy metals tonight, so I didn't go through these. But they're all there. Now, let's talk about what are some things that increase the IL-6. And again, I have all these slides. I have a slide for each of these in the appendix. Diabetes, high blood sugar, obesity, high homocysteine, high dopamine. And then, of course, when the renin-angiotensin system gets upregulated, and we have higher angiotensin 2. Histamine, which interestingly is a byproduct of interleukin 6, and I'll show you a chart in a little bit. It actually stimulates it like a positive feedback loop.
Mm-hmm.
Estriol, we spoke about this earlier. Over-exercise.
Mm-hmm.
We can exercise too much.
Bob, out of curiosity, the estriol study, was this excessive amounts of estriol? Was it an estriol deficiency? Do you remember?
No, it was excess.
Excess estriol.
Mm-hmm.
Because, we use estriol as an adjunctive hormone replacement therapy for vaginal atrophy.
Well, again, I go back to Goldilocks and the Three Bears. We need some. Excessive can be a problem.
Mm-hmm.
Oxalates, and this is an area that we are finding is becoming more and more serious. Some of the healthiest foods, your spinach, kale, and beets. I'm sure you've had this happen. Somebody is not feeling well and they decide, well, I'm going to start eating better. I'm going to eat healthy. And they start doing, smoothies with spinach, kale, and beets, and all of a sudden they start feeling worse because these oxalates that are like little razor blades in some of the healthiest foods, if they get into the body, they can create tremendous inflammation. But interestingly, they're a stimulator of interleukin 6. mTOR, mammalian target of rapamycin. I think most people know what this is, but it's the growth of new cells. It is the inverse of autophagy, the cleaning of the cells. And one of the studies that I did back in 2018 that I presented at ILADS was that those with chronic Lyme disease seem to have genetic mutations that would upregulate mTOR and downregulate autophagy. And much of this now is being amplified by all of the things we're doing to our environment. The plastics, the genetically modified foods, giving our animals growth hormones. Dr. Patrick, I think someday we're going to look back and say, what in the world were we thinking? Right. Giving our animals growth hormones so they get fatter faster.
And also it's a recipe for oncogenic metabolism, really.
Sure.
When you downregulate autophagy and upregulate mTOR.
Absolutely. Yeah, mTOR is the replication of cells. It doesn't care whether it's a healthy cell, cancer cell, or hang on to your hat, COVID. COVID hijacks mTOR for replication. And bradykinin that we're just starting to learn about also upregulates IL-6. And one of the signs of high bradykinin is chronically low blood pressure, but yet inflammation. So these are the things that can create it for us. Then environmental factors. I know, we've both been very interested in mycotoxins. And, back in last year, we did a 3-day conference on mycotoxins. And mycotoxins will stimulate interleukin-6. Lyme disease stimulates interleukin-6. So I'm sure, you see many people that have mycotoxins and Lyme disease, and they're really sick, and they can't seem to get off that roller coaster. How many folks do you see like that?
It's in complex patients, it's very, very common for them to be so inflamed that not only can they not think, but they can't move. So it's literally interrupting neurologic function, and it's basically making it very hard for them to do daily activities of living.
Absolutely. Lipopolysaccharides, that is the gram-negative bacteria. Interestingly, I saw one paper, and it might be in the slides, that there is some thought that the spirochete gives off a lipopolysaccharide.
Really?
Could be one of the reasons why you have some of this chronic inflammation. I'm sure it's more complex than that, but that would be fascinating to go down that bunny trail.
It's a cell wall of the spirochete, basically, right?
Mm-hmm. Yes.
Yeah, that seems perfectly reasonable.
Now, this one made me sad. That's why I have the
I
sad.
don't like this, Bob. I want you to cross that off.
I know. And if somebody's interested, look at the slide. Just a little over 6 ounces of coffee can increase interleukin-6. Ouch.
Now let's drill down, because we know that there's chlorogenic acid in the coffee bean, which is an extremely important flavone, right? So there are good things in coffee, but I had this long-standing, ongoing conversation with Walter Krinian about organically grown coffee versus non-organically grown coffee. He had found some references that show that in the roasting process, the organophosphate pesticides are basically burned up, right? They're eliminated. But I found some research that shows that the fungicides, which are also used on the coffee bean, obviously it's in a humid environment, are residual to a certain degree, depending, of course, on a variety of factors. And I'm wondering if it's a residual fungicide that is, because fungicides are extremely toxic. They're more toxic by, ounce per ounce weight than an organophosphate pesticide or a carbamate pesticide. So what do you think?
That all sounds very feasible. And then also for some people, coffee increases dopamine, which increases your interleukin-6 as well. So you're absolutely right. There's some things with coffee. And I'll admit, I did not stop drinking coffee. But maybe I'm not having that extra cup if I think I need it, just to, be on the easy side. But
I'm very interested in this reference. This will be in the index as well.
Yeah, in the appendix, yes.
Okay.
Mm-hmm. And as you mentioned at the top of this webinar, we just did as when we recorded this the day before, we did one on electromagnetic fields, and EMF upregulates interleukin-6. No surprise here, radon does. What I encourage everyone to do is there's an excellent website, radon.com, and you can actually, click on your state, your county, and see what your radon levels are. But I think everyone should be checking the radon where they live.
Absolutely. It's the second, as far as we know, it's the second leading toxicant in terms of its ability to and propensity to result in lung cancer. And it's very common where I live in the Rocky Mountains. I have radon remediation in my home because I had high radon levels. And I think it is, we as clinicians have to practice good public health education, and everybody literally who lives in either the Rocky Mountain states and I would say all the way down to Mexico, including Arizona, And the Northeast has to have their basement checked for radon.
Absolutely.
So, yep.
Yeah, so it's radon.com. Check it out. And then there's some interesting devices that you can buy online that you can just continually electronically monitor your radon. I got one of those, and I'm such a geek for my three children. I bought them petri dishes to check for mold and electronic radon detection for Christmas. You know, they looked at me like, "Oh, Dad, really?" But
just a good father, Bob. That's what it is.
okay.
Loving father.
I figure someday when they're around 50 years old, they'll say, you know, the old man was way ahead of his time. But for right now, they just kind of rolled their eyes a little bit, but that's okay. Air pollution that we talked about.
Right.
And, you know, the forest fires burning in, I guess you had some of those in Colorado too. Wasn't there some forest fires?
We're actually putting together a presentation. I'm working with a doctor who lives in Portland. There's an air monitoring system called Purple Air, which is a crowdsourced home monitoring system. You can actually buy them online. They use the EPA software to look for particulate matter. And she got readings as high as 700 during September. And the EPA monitoring system only goes up to 500.
Wow.
So we're in the process of and I've written some blogs. They're right up there with your blogs on the EHS blog page about how to address this because of the downstream effect of declining lung function that's already been seen in the studies they've done in Montana. Just a 6-week period of exposure to air pollution, and 2 years later, a doubling of the rate of decline of lung function in older adults.
Absolutely.
So, yeah, we have to pay attention to this because we're going to have fires like this every season now, every summer.
And that's why I'm a big fan of making sure you have good air purification inside the house.
Absolutely.
And if somebody looks behind me, right, there's a molecule sitting there to purify the air. And right on the other side of me is I think it's IQ Air that has 27 pounds of carbon filter.
Yes, I have an IQ Air as well. And yes, we all of us that were living in areas where there were forest fires had 1 or 2 IQ Air filtration, or some of us had 4 IQ Air filtration systems running full time.
Absolutely. Yes, I advise many of my clients that they really need to make sure that their air, the air they're breathing, has less particulates. Stating the obvious here, volatile organic compounds, quite an issue. And then we could spend the whole time here talking about glyphosate, but you know, Stephanie Seneff has done groundbreaking work, but the literature's out there. It increases interleukin-6.
Yeah, you know, the difficulty, I don't want to say difficulty, but the complexity of Roundup formulations are that they not only contain glyphosate, they contain AP, ethoxylated petroleum products. I think it's APOE is the acronym, but they're more toxic than glyphosate as actual cellular toxins. Dr. Cerulini's published this. And so it's really a bouquet, so to speak. It's you know, not an apt analogy, but it is a combination of a variety of toxic substances that ends up in the Roundup formulation. I think glyphosate is like a surrogate. It's toxic itself, you know, it has a lot of toxic effects. But the actual end result of exposure to Roundup formulations is basically could not do anything other than cause inflammation because of the kind of synergism of those toxicants.
Absolutely. And we're going to round it up with sodium sulfite, some of your food additives. So these are the things that can come from our environment. And then these are the things that can be inside of us. And between the two, no wonder we have all this inflammation going on. Now, our subject is heavy metals. Here's a study. Short-term exposure to aluminum resulted in an increase in the systemic inflammatory parameters, IL-6. Now, of course, what that's going to do, it's going to reduce your glutathione. So glutathione concentration decreased significantly upon that aluminum exposure. And I don't think this would happen with everyone, but as we know, selenium is a cofactor for glutathione. And it says both the increase in IL-6 and decrease in glutathione status could be prevented by co-exposure to selenium. So that's interesting about the selenium, but I was putting this slide up specifically just to talk about how aluminum increased the interleukin-6.
Which is an adjuvant in our current vaccines.
Yes. Now, this is the heavy metal lead markedly augments the lethality of endotoxins in laboratory animals. Lead-exposed mice showed an altered IL-6 appearance in the brain in that the levels of IL-6 in the brains peaked at 4 hours rather than 3 hours, the peak for the control mice. At 2 time points, the amount of IL-6 were found to be higher in the brains of lead-treated mice. So, obviously you're the expert on lead.
Well, that
and
makes
it has
sense. Lead causes oxidative stress in a variety of ways, and also prevents the production of a variety of neurotransmitters as a result. So yeah, lead is an oxidant par excellence. So it makes sense that ROS would lead to IL-6.
Yes. I found it interesting, though, that it made endotoxins even worse.
Mm-hmm.
So here's another study. The serum levels of interleukin 1 beta and interleukin 6 and tumor necrosis factor alpha were significantly higher in the group of workers chronically exposed to lead compared to control values. There's the percentages. And the results of the present study indicate that chronic occupational lead exposure promotes inflammatory processes via inductions of these pro-inflammatory cytokines. So just another reason why the lead is so serious for us.
Well, I was trying to explain to somebody yesterday why their patient who had gout had to be checked for lead, because lead is the #1 actual causative agent for gout. And it's not just the uric acid crystals, it's actually systemic inflammation that's caused by lead.
Absolutely. Now, what can we do for this interleukin 6? So we went through the literature, and no surprise here, curcumin was found to reduce circulating interleukin 6 concentrations. And the authors found that lowering capacity was not dependent upon dose or duration of supplementation. Pycnogenol, of course, we've known about this for a long time. During a meta-analysis and systemic review, pycnogenol was found to decrease CRP and have an anti-inflammatory action. So IL-6 induces CRP, and IL-6 and CRP may be synergistic. I was surprised by this one. Riboflavin and thiamine support the anti-inflammatory activity of dexamethasone and reduce production of tumor necrosis factor alpha and interleukin 6. Again, a published study. Then the black cumin seed oil. This was a very lengthy article, so I just put the conclusion in. Black cumin seed oil significantly reduces interleukin 6 levels. And of course,
Bob, are you using the oil of the black cumin seed?
In the formula that I put together, no. But if somebody really, needs it, they may want to get the oil. It's probably superior.
Mm-hmm.
Now, this one blew me away. Apigenin, found in parsley and chamomile, has been shown to, this blew me away, enhance the expression of glutathione synthase, catalase and SOD, inhibited NADPH oxidase. Now, I'm going to be talking about this a little bit later. I am very intrigued by NADPH oxidase. Cliff notes on it is when we're faced with a bacteria or some other pathogen, NADPH oxidase takes oxygen from iron, an electron from NADPH, and makes superoxide, hydrogen peroxide, stimulates mast cells, stimulates histamine to kill the pathogen. If we didn't have that, we'd die of infection. But once again, environmental factors are upregulating this. In the webinar that we just gave on EMF, it was shown that it's the EMF upregulating the NADPH oxidase that accounts for some of the oxidative stress from EMF. It increases NRF2. Now, if anyone doesn't know that, that's nuclear transaction factor, and that is the making of, the utilization of, and the recycling of your antioxidants. Studies have shown that in mammals, the animals that have higher levels of NRF2 have a longer lifespan. Lower levels of NRF2, lower lifespan. and strongly decreases interleukin 6. Now,
That's,
who'd have thought? Parsley and chamomile.
so, Bob, this is fascinating to me as well because Bernard Hennig, who's an amazing researcher at the University of Kentucky, has been grappling with this issue of the way that certain pollutants cause damage in the body. And specifically, he's looking at organochlorine pesticides, the ones that were, the legacy ones that were taken away, but are still in our food supply. And what he found is that these flavones, actually downregulate the aryl hydrocarbon receptor, which is that cellular receptor that gets activated when a whole variety of pollutants basically are on board. It activates this aryl hydrocarbon receptor, and this aryl hydrocarbon receptor is the main switch to turn on IL-6. And so what he's found is that things like fish oil, many flavonoids, curcuminoids, obviously, EGCG from green tea, etc., all work to downregulate the activation of the aryl hydrocarbon receptor. And so he's actually advocating in very specific situations using these interventions to prevent some of the sequela to the upregulation of the aryl hydrocarbon receptor aren't just cytokine storm and increased IL-6, but cancer. So he's doing some great research. And I think that what you're talking about right here is exactly that. That apigenin also is going to downregulate this aryl hydrocarbon receptor initiated inflammatory reaction.
Absolutely. I was very, very excited about this. I mean, we should be shouting this from the rooftops that
yes,
this is a big deal.
Yep.
Selenium, I mean, no surprise on this one. Selenium is a cofactor for the use of glutathione. Serum selenium was significantly inversely associated with interleukin 6 after adjusting for potentially other factors. So no surprise there. So that's why I worked with personalized nutrients, compounded nutrients. I created a line called Functional Genomic Nutrition, and we created a product called Cytocalm 6. And what did we put in it? Riboflavin, calms it down, selenium that we just spoke about, black cumin seed powder, turmeric, pine bark, boswellia, parsley, skullcap, olive leaf, thiamine, benfotiamine. Benfotiamine is the active form of thiamine, and a little bit of black pepper, just 5 milligrams. If a doctor is watching this and would like to order it for their patients, functionalgenomicnutrition.com. There's the wholesale and retail. And if they'd like, they can contact Compounded Nutrients. We can get you that information. And the doctor can actually private label this if they'd like to put their clinic on this product. And I think they only need to buy 12 or 24 bottles.
And the apigenin is coming from the parsley leaf powder?
Yes. Mm-hmm.
Great.
Yeah.
That's a really good formula.
Yeah, I'm really excited about this. It only arrived in our office just probably in the last 2 weeks, right after the first of the year. And we're really excited about this product because I'm beginning to believe those people that are dealing with Lyme disease, with mold toxicity, with some of these other sensitive things, they really are having an upregulation of the IL-6. Before this product came out, I mean, I was trying these things separately. Riboflavin, benfotiamine, parsley, turmeric, black cumin. There was a lot to put together in single bottles, but we were seeing a lot of folks, particularly those with, gut issues, because the interleukin 6, I didn't have that slide up, but interleukin 6 is behind inflammatory bowel disease, even just the upregulation of the gut where you've got, too much motility. Many people are having gut improvements as we put these together. I don't have any feedback yet on the combination, but I expect it to be similar.
And boswellia as well, right? The ACBA research, I've seen a lot of research looking at boswellia and IL-6, specifically in arthritis. But
absolutely. Yeah, that's why boswellia might be so helpful for arthritis. So there's the website, functionalgenomicnutrition.com. Now, in Appendix D, I have additional nutritional support for interleukin 6. I didn't put it here. Now, this is an interesting map that we made up. And what I'm going to do is, this is in the slide. I'm actually going to slide this guy over here. This is the actual map. So I want to walk through this a little bit. Here's interleukin 6. And I'll blow this up a little bit here. Over to the left here, again, we're showing all the environmental stimulation, mold and mycotoxins, Lyme, lipopolysaccharides, EMF, radon, air pollution, smoking. I forgot to mention smoking, that's another one. Sodium sulfate in coffee, all the metals, glyphosate, some of the canola oils, VOCs, pesticides, and any mTOR stimulator. And then internally, histamine, dopamine, angiotensin 2, NADPH oxidase, bradykinin, obesity, hyperglycemia, high homocysteine, oxalates, C. diff, too much of the estriol, hydrogen peroxide. If we don't have enough catalase and glutathione peroxidase and peroxidases, we're not going to clear that. As we discussed earlier, over-exercise, virus, and anxiety. Then over here, hydrogen water. I'm a big fan of, dropping that tablet in the water. Thiamine and riboflavin.
Just want to remind you, because I think people need to hear you say it again, what you said last night. Do you remember about the if you only had one intervention?
Oh, yes. I've often said, if I could just take one thing. Somebody said, Bob, there's a new law. You can only take one thing. I'd probably pick hydrogen water. And that surprises some people because all you do is you drop a tablet in water. As we all know, water is H2O. It knocks the hydrogen loose. Number one on the periodic table of elements. Seems absurdly simple, but it upregulates your glutathione, your SOD, your catalase, and now we're finding it lowers IL-6. So I'm a big fan of hydrogen water. I try to get it in every day.
And there's no downside.
None.
Right?
None. Well, if somebody has specific SIBOs, sometimes the hydrogen combines and they feel really uncomfortable.
So if they have a hydrogen sulfide or hydrogen SIBO.
Yes.
Yeah, form of SIBO.
Yeah, it doesn't work.
Okay.
But it's a good tool to know that you've got some work to do. Black cumin seed oil, as we discussed, apigenin, pine bark, oxytocin, some PEMF, and of course, vitamin D. Now the studies are showing that, vitamin D levels is a factor, not in preventing COVID, but in potentially not letting it be as serious. The omega-3s, some hyperbaric oxygen, selenium, as we discussed, making sure your blood sugar is under control, healthy weight, and moderate exercise. Now, let me show you what happens. When interleukin 6 gets stimulated, you can sometimes have mutations in the IL-6 genes. So that's why I believe it's so important to look at your functional genomics and see if you've got mutations here. Just us observing, when people have a lot of homozygous variants in IL-6, many of these people have inflammation that they can't seem to get under control.
And is that because it's not the mutant, so to speak? I know that's the wrong word to use, but the variant is makes unresponsive IL-6. Is that what
it's a gain of function.
So it just upregulates IL-6 production and you just make more.
Yes. And we're identifying which ones are gain of function.
Yeah.
So that makes CRP, superoxide. If we have mutations on our superoxide dismutase, we're not going to be able to handle that. Then superoxide combines with nitric oxide to make the very oxidizing agent peroxynitrite. And as we spoke earlier, that can impact your melatonin. Your glutathione is then used up in a desperate attempt to deal with this peroxynitrite. Then we can combine with CO2 to make carbonate radical, which actually damages the DNA. It oxidizes the guanine. Then we need an ample supply of NAD plus by the PARP enzyme to do that DNA repair. But there's this dance because we need NAD plus to make NADPH or NADH for your electron transport. We also need it to make NADPH to recycle our antioxidants. And we also need NAD to stimulate the sirtuins that make your SOD and catalase. So the more demand we put on NAD for repair, the less we have for all those other good functions. And if we have an opportunity, we'll talk a little bit about the NAD pathways. Then this stimulates NOx, and you'll see that there's and this is NADPH oxidase, what we spoke about. And there's a line that goes both ways here. IL-6 stimulates NOx, NOx stimulates IL-6. Then we get the mast cells. And probably when you and I started, studying, we probably didn't spend a whole lot of time on mast cells. We didn't even talk about it much. Now, mast cell activation has become the buzzword,
Well,
and it seems to be a serious problem.
it's an epidemic, I think, really. It has become common. Let's put it that way.
Yes. Every time I teach a class, I ask doctors who are teaching or are practicing more than 20 years, how much mast cell activation did you see 20 years ago? And it's like, well, we didn't.
Nothing.
Yeah. And now it's like every third patient they see has mast cell activation.
Yep.
Now, the KIT genes, when there are some that are mutated that will upregulate the production of mast cells, heme oxygenase downregulates mast cells. And we don't have much data on this yet, but we're going to be studying this intently. Mast cells stimulate interleukin 13. Mutations in interleukin 13 cause it to feed back and create more mast cells. Then the mast cells, as we know, makes histamine. And then we need the enzymes histamine and methyltransferase to degrade the histamine. We need MAO to do the job after H&MT. ABP1 makes the diamine oxidase enzymes. And very, very common is genetic mutations in ABP1 that they don't make enough DAO. That's why for some individuals, high histamine foods is a problem. So, well-meaning people say, feed your gut and, do all the fermented foods. That's fine unless you've already got too much histamine and you don't have enough DAO, you're making the situation worse. Now, one of the other enzymes that we're really spending a lot of time on, I'm very intrigued by this, Histidine Decarboxylase. This is what takes histidine foods, not histamine, the amino acid histidine, and by the HDC enzyme, uses B6 to upregulate histamine. Now, I don't have it on this chart, but ECGC, iodine, and testosterone inhibit HDC. So what's happening to us, our testosterone levels, particularly among boys, is dropping sharply.
Yep.
So that could be a factor, is why we're seeing so much anxiety. When I talk to college professors and I say, tell me about the freshman boys coming in, common term I hear is fragile.
Oh, yeah. I just talked to a physician today, was hours ago, who had a young boy that came into his clinic who was suicidal, who had a testosterone level of 6.
Ooh.
Like 1, 2, 3, 4, 5, 6.
Yikes.
Yeah.
Yeah. Well, it's not surprising with all the xenoestrogens that we're being exposed to. And as we all know, sperm rates have dropped 53% since 1973. And we've always had percentage of the population gay, but now the transgender or non-binary, not knowing what you are, is just skyrocketing.
Mm-hmm.
On the college campuses, it's a big deal that you don't be called he or she, you be called we or they.
Yeah.
Because it's not just being gay, it's not knowing if you're male or female or thinking you're both. There's got to be an environmental component to that. And the ramifications, I believe, for various illnesses as a result of this, we're probably going to be mind-numbing as we learn more as time goes on.
Yeah, I just want to backtrack for a second. Remind me, what are high histidine foods?
Oh, that's things like pork chops, beef, some chicken, particularly chicken breast, eggs, milk, tofu. There's a website, if you just Googled 10 foods highest in histidine, they actually list them. So, and again, histidine is an important amino acid. It's not bad. Okay. But now everything I've said so far is based upon peer-reviewed literature. I'm going to venture off and give you a Bob Miller hypothesis.
Good.
I have a sneaking suspicion that there's intelligence in the body when the body wants mast cells. Just intuitively, I believe it probably signals HDC and says, hey, crank it up a little bit.
Mm-hmm.
And that's just pure speculation. Might be right, might be wrong, but it would make sense that there's a signal going over here that says, okay, come on, take some of these histidine amino acids and give me more histamine because we've got an enemy to fight. And again, mast cells and histamine are life-saving. Without this, we die of infection. But what I've been saying for a long time now is environmental factors that we weren't exposed to 50 to 75 years ago is just kicking these guys excessively, or NOx enzyme, causing the production of the mast cells. Now, this is where it gets really interesting. There's literature out there, superoxide mast cells and histamine stimulate the renin enzyme. So this RAAS gets upregulated. So here you can see high glucose, superoxide, mast cells, histamine, dopamine, and testosterone stimulate the renin enzymes to take your angiotensinogen, turn it into angiotensin 1, then angiotensin 2, and then that stimulates interleukin 6. And we have one cool little feedback loop going on here that just feeds upon itself. So again, hypothesis, is this possibly why someone gets Lyme and the Lyme is cured, but the pattern still keeps going on? I throw that out as a hypothesis. I call it actually the Holmes hypothesis. Now, if you have mutations in ACE2, I think it's very important to know if you have mutations in ACE2, that's going to inhibit your angiotensin 1 and 2 conversion to angiotensin 1-7, which is anti-inflammatory.
Right. So that feeds inflammation. And what is the COVID relevance there?
Well, COVID comes in using ACE2.
So that means that you would potentially have more angiotensin 1 versus angiotensin 1-7?
Yes. And then more interleukin 6.
Right.
Now, this we just recently found. Glutamate, which is the neurotransmitter that makes you intelligent, highly motivated, go-getter, very high in particularly Northern Europeans, in excess will inhibit ACE2. So here's your anxiety relationship to inflammation. However, bradykinin, which has also been implicated as being high in COVID, is broken down by CPN1 and ACE2. So if you've got mutations in ACE2 and high glutamate, double whammy here on stimulation of interleukin 6. So that's why for a long time I've been a big fan of looking at the GAD genes, the DAO, and when we say DAO, we're not talking about the enzyme that breaks down histamine. That's the ABP1 genes. Mutations here cause more creation of glutamate, and we've just started looking at the KRAS. Mutations in KRAS inhibit the GLUT enzyme that puts glutamate into alpha-ketoglutarate. So you're not going to then get your cellular energy, and plus you're going to get more excitatory glutamate. And I believe glutamate is on the rise. I mean, these are people that can't sleep, they're anxious, they've got a little tremor, they're sensitive to bright lights and loud noise, they're a little bit paranoid. Sometimes they'll have visual hallucinations or auditory hallucinations as the glutamate goes up farther.
Yes, I've seen the same thing.
Yes. So I'm a huge fan of hinokial and L-theanine and magnesium 3 and 8 to try to support that. I've actually made some formulas called Excitoblocks Rest and Excitoblocks Clarity that are specifically designed to keep that glutamate under control. So I looked at it before as just yes, let's make sure that we don't have the anxiety. When I saw this, I just about fell off my chair, that the glutamate, will actually weaken ACE2, and that will increase angiotensin 2 and increase bradykinin. So double whammy. And as we said, these are the two culprits potentially behind the cytokine storm. So I believe this is a very significant pathway, and learning how it works and where to make interventions that are applicable. Now, let me show you another slide here, and this is beyond our scope for this talk, but this is a slide that these are all products that I've made and formulated through personalized nutrients that could intervene specifically where you need to. So if you've got weakened HMOX inhibits angiotensin 2. So there's a product called HMOX Assist. If you don't have enough SOD, there's a product called SOD Plus. The product for EMF that we didn't talk.
Can I ask you about the SOD Plus?
Sure.
I wanted to ask you this last night, but there were so many questions. I didn't want to hog the Q&A. This is a question that in general I always think about, because SOD, catalase, and hydrogen peroxide are the real antioxidants in the body, right? They run the show. We think of vitamin E and vitamin A, but it's really SOD, catalase, and hydrogen peroxide. And you may disagree, that's fine. But I'm assuming that upregulating SOD is critical in situations like this and so many others. Can we get superoxide dismutase into the bloodstream from the mouth? This has always been my question.
Well, yeah, I mean, that's an excellent question, and I'm afraid I don't know the answer to that. But what we did is put in SOD+, and I don't have the label here, but some other things like lycopene, some catalase, and other antioxidants. But that's a good question, and I don't know the answer to it.
So your trajectory is, let's raise SOD production by increasing the nutrients that are needed as coenzymes or in the coenzymes. Is that?
Oh, yes, that as well. Mm-hmm. Now, just clinical observation. And I know you said that hydrogen peroxide can be an antioxidant, and I don't disagree, but if it's not cleared properly and combined with iron, it'll make hydroxyl radicals.
Oh, no, I was talking about glutathione peroxidase as an enzyme. That's a real...
Oh, I'm sorry.
Yeah.
Yes, you said hydrogen peroxide.
No, glutathione peroxidase.
Okay, you scared me there for a second.
If I did say hydrogen peroxide, I meant to say glutathione
peroxidase.
Yeah.
Got it. Okay. Yes, if anybody heard that, just we'll make it clear. It's glutathione peroxidase. So again, just Bob Miller observation. SOD takes your superoxide, turns it into hydrogen peroxide. I have seen individuals, when they take SOD, they do worse. And when we add catalase first, just catalase, then the SOD, they did just fine.
That makes sense.
Yeah.
Explain to everybody why adding catalase in makes sense. They might not.
Sure. Well, let me see if I can pull up a slide here. I think I can do this. Here's a slide. Oops, hold on. Let me just go down to this one. 1 second here. Let me find it. Yeah, this is very important. This is called the Fenton reaction. And the Fenton reaction occurs when hydrogen peroxide combines with iron to make hydroxyl radicals. So let me pull this guy over.
Which happens all the time when people breathe air, because there are iron nanoparticles in air pollution. Sad.
Yes.
Tell you that there are.
Yeah. So here's your electron inside the cell. As we're making energy, it'll combine with oxygen, make superoxide. We need superoxide dismutase to make hydrogen peroxide. Mm-hmm. Then we need catalase, and as you said, glutathione peroxidase. Then we need the peroxidases to clear that hydrogen peroxide into water. Now, keep in mind, they're all NADPH dependent. You need your NADPH to keep recycling this. So if your NOx enzyme is constantly being upregulated, I'm calling this the NADPH steal. Mm-hmm. That NADPH is being stolen to make inflammation rather than doing all this good stuff. So back to the Fenton reaction, discovered in 1895 by Dr. Fenton. Iron will combine with hydrogen peroxide to make hydroxyl radicals. And that's why I'm a big fan of hydrogen water. H2 plus OH minus equals H2O. But back to the catalase. So I gave people some SOD, and it's like, oh my gosh, Bob, I felt worse. We gave catalase to clear the hydrogen peroxide, then superoxide dismutase worked. Now, that's just an anecdote. I've seen that happen maybe 3 or 4 times. So we can't say for sure that's happening, but that illustrated to me that if you take more SOD and you're not clearing the hydrogen peroxide, you can actually make the situation worse.
That makes total sense.
That's why in my SOD plus, I put SOD and catalase, lycopene, maybe some pine bark, I'm not quite sure. So we have to calm down this superoxide. Then if we make peroxynitrite, there's a product called peroxyblocks, designed in many ways to knock down the peroxynitrite. If someone is really interested, take my online certification course where we go through all that. Glutathione conjugation support could be needed over here for the glutathione to knock it down. Then, if we need more NAD, I'm a big fan of nicotinamide mononucleotide in the NMN plus NADPH assist, which has multiple nutrients in it that support the production. But you got to be careful. I think we tend to get on bandwagons. We hear about how important NAD is, and we start to take it. And some people do well, and some people do terrible. Well, the reason they do terrible is if NOx enzyme is upregulated, and it's taking this nicotinamide or NADPH, you can actually make more inflammation by taking nicotinamide mononucleotide. So that's why I keep stressing, before we give NMN, we darn well better make sure that NOx enzyme is calmed down. Mm-hmm. Then push that as well.
And then can you just remind me, and for the benefit of everyone who didn't hear last night's lecture, about the EMF Protect ingredients?
Oh, the NADPH Protect ingredients?
The EMF Protect.
Oh, the EMF.
Yeah, peroxynitrite, which is the radical, one of the radicals,
Sure.
Damaging radicals from.
Sure. So what we put in here was a little bit of cat's claw, because that's a natural calcium channel blocker. And of course, we know that when people have mutations in the calcium voltage channels, or just overwhelmed with EMF, extra calcium will go in that will stimulate the nitric oxide, the superoxide, to make peroxynitrite. So we put a little bit of cat's claw in there. Then we put some magnesium. There's two herbs that have clinical studies on that scavenge peroxynitrite. That's witch hazel and rosmarinic acid. Then we put some SOD and catalase in, and some selenium, and I think 5 or 10 milligrams of NAD.
Great.
Just to support that EMF damage. Now, I'm beginning to believe that, again, mast cells is being upregulated. Product called Memc Stabilizer. Histidine is an interesting product. Has typical things like nettle and quercetin to knock down histamine, but a little bit of adrenal to support the adrenal glands. And I'm really proud of this one, DAO support. There's lots of people out there that have the porcine kidney for the DAO, but we put in it ECGC, just a little bit of iodine and black cumin seed oil to calm down Histidine Decarboxylase. Nobody's done that before. And swinging around here, I think I caught it all except NADPH Protect, multiple things that just in a broad spectrum calms down NOx. And then really happy with this one, aldosteroese, that will stimulate the ACE2 enzyme. And we've seen reductions in blood pressure by taking aldosteroese.
Great. And just because this came up, I'm taking an advanced immunology course, and this came up in our course when we were talking about functional ways to deal with excessive IL-6. There's no way that you're going to give people herbs and supplements and suppress their IL-6 to the degree that they're going to be more susceptible to infection. Correct?
I would think so, yes.
Yeah.
I would think so, yeah.
Just in case someone's thinking that this is a pharmaceutical approach or a pharmacologic approach, it's really not.
Exactly. Then for the glutamate, we have 3 products, one to take for sleep during the day, and one in general that controls that glutamate. And so the nice thing about this is when you look at someone's genome, obviously you don't give all of these things. I mean, that'd be way too overkill. But by looking at the functional genomics, you can see precisely where it's given. And that's, what we have to do in the future. We have to have precision care. We've got to move away from the pill for the ill and start looking at what can we give specifically for an individual for them. You could see 5 people with the same condition, perhaps 5 different ways they got there, and 5 different ways that we have to get them out of that problem.
So Bob, I was thinking about the one question I wanted to ask you tonight, because you have a gifted brain and you have a tremendous amount of experience seeing sick people. So here's my question to you, and this is relevant to metals. We hypothesize, I know that you and I do, that people who are the most chemically sensitive either have been exposed to the highest levels of toxicants, or they're the most susceptible as a result of their SNPs. So I have a theory about what SNPs those might be, but I would love your ideas about what SNPs you think make people chemically sensitive or predisposed to chemical or metal sensitivity or toxicity.
Sure. Well, firstly, I agree with you 100%. I'd only probably just tweak that a little bit to say it's probably a combination
Right.
of genetic weakness and, because two people can be living in a moldy home and the one person is sick as can be, and the other person says, what mold? This must be all in your head.
Right.
One person is sensitive to EMF and the other one laughs at them and says, oh, come on, you're just faking it. That can't be. So they're both exposed to the same stimuli, but they're reacting differently because of their genomics or other exposures that they may have had. Back to the 3D chess game. Now, to answer your question, what I think are the most common issues, the most common combination I see is overabsorption of iron by even like carrier status on the hemochromatosis genes. Or there's, there's TRF, there's TRF2, there's a couple of them, anything that would cause you to overabsorb a little bit more iron. Then combining that with weakness in G6PD or ME1, which is the major producers of NADPH. That to me is the combination I see in those that are really struggling. So they're overproducing the free radicals through Fenton. And let me see if I can go back to this chart here.
So kind of a mitochondrial toxicity picture, is that what you're
Yes.
together here?
Yeah. So if they overabsorb the iron, maybe they have some weakness in catalase, but particularly if they don't have NADPH, they're not going to be recycling their glutathione, their peroxidases. They're not going to clear that hydrogen peroxide. That iron is going to collide and create a problem. Most common thing that I see. And this oftentimes happens when one parent is English, Irish, or German, or Ashkenazi Jewish, and then the other parent is Northern African, Native American, or Sicilian. And they've got the NAD, the Northern Europeans are very susceptible to the overabsorption of the iron. The Southern Europeans and the Native American Indians are very susceptible to NADPH deficiency. Now, it's interesting how these genetic mutations came into play. Particularly G6PD deficiency protected you from malaria. So in times of malaria, it was to your advantage. As we know, in England and Ireland, there was many times potato famines. And people who got the mutation where they overabsorbed iron, they actually did better. They were healthy enough to have babies when they had the overabsorption of the iron.
Fascinating.
Yeah, come to America, where we put iron in our foods. We're not in famine. Most common thing I see is people that overabsorb their iron. And then if Fenton reaction occurs, the doctor says, oh, you're anemic and you need iron. And they get worse. Now, interestingly, interleukin-6 creates hepcidin, which lowers iron. So I tend to think that, are there people who are low in iron and need iron? Sure. But do I think we oftentimes give iron inappropriately and make the situation worse? I think probably more than we realize. I've just seen countless people, we get their catalase going, we get their glutathione peroxidase going, we get their NADPH going, and they're not anemic anymore without taking iron.
That's a great clinical pearl, number one. And number two is I can't tell you how many women I've seen treated for anemia who have high ferritin.
Yes.
I mean, you see that all the time, right? Elevated ferritin, low hemoglobin. Yeah.
Mm-hmm. Yeah. Now, if you'd like to see my second most common thing that I think we see, and I'll pull this in a minute, and it's the Nasan coupling. And that is when either something impacts the BH4, and I'll pull this up in just 1 second here. So in the software here, we have what are called pathway maps. And I'm going to show you the Nasan Coupling Map. Now, this is actually an interactive map on an individual. Okay. So you can see here that these are the genes involved with making nitric oxide. We need BH4 NADPH, heme, oxygen, and L-arginine for the NOS enzyme to make the nitric oxide.
Mhm.
There's a heck of a lot that can go wrong here. As you can see, this person has the MTHFR A1298. You see I clicked on here and it brings it up. Also, if the person does not clear ammonia, ammonia will take up BH4. So this is the urea cycle. And these ratings here, when they're negative, means there's more mutations in the average person. Then NADPH, and you can see this person had quite a few mutations, including G6PD and the IDO1, the primary producers of NADPH. And then the heme pathway. Look at all these mutations in the heme pathway where we take succinyl CoA and glycine to make heme. Heme is a cofactor for nitric oxide. This was an individual who, at the age of 18 and 19, had to be on pain medications from fibromyalgia and thought they'd never be well. And so you can see this Nasan coupling. So that's my second most common thing, where there's, and again, even though NADPH, I said, is involved with iron oxidation or Fenton reaction, it also plays a role in the nitric oxide. So those are my top ones. The other one that I think we need to be really paying attention to is NQO1. NQO1 is what takes NADH. Have it in a second here. Oh, by the way, here's your G6PD and the pentose phosphate pathway, ME1 in the Krebs cycle. Then you make your NAD plus, and this is why people take nicotinamide mononucleotide or nicotinamide riboside. So that NAD plus goes up to NADH. We need NQO1 to bring this back down. I found mutations in these. People are really struggling because they're stuck up here. And when this ratio is off, it's pro-inflammatory. And good old Paul Diarco supports that NQO1 enzyme. And then it comes down into NADPH. So here's your PARP enzymes that does repair, your sirtuins that make your catalase and SOD. And interestingly, SIRT3 supports autophagy, while SIRT1 inhibits mTOR. Now, while we're here, let me just show you why I believe NADPH is so critical, because NADPH is needed by NOS, as we discussed, thioredoxin, glutathione, actually part of your heme to biliverdin. But the NOx enzyme, when it's upregulated, takes that NADPH and uses it in what I call the NADPH steal to make the superoxide, the hydrogen peroxide, the mast cells, and the histamine. So if someone has upregulation of NOx, genetic mutations that they don't make enough of this, these are the folks that, they get near somebody with perfume and they're sick.
Or they're exposed to an amount of a toxic metal that another person would be able to function with, and they can't function because their mitochondria stop working.
Absolutely.
Yeah.
You know what? And I should really point out, if I can here, I should have pointed this out when I had this over here. Aluminum inhibits DHFR and lead inhibits NOS3.
Mm-hmm.
So DHFR is part of your BH2 to BH4 conversion. So if we don't have enough DHFR going, we're stuck in BH2, and BH2 combining with this just goes straight to superoxide. And then if we have lead, the NOS enzyme, NOS3 is the one that primarily makes your endothelial nitric oxide. And then not only do you not have that, but you make more superoxide, combines with nitric oxide to make peroxynitrite, which suppresses BH4. So if somebody said, what are the two common themes that I see for people with excess inflammation? It'd be the Fenton reaction or the Nasan coupling.
Great. I have to think about this a lot. I mean, I'm embarrassed to say that I have an undergraduate degree in biochemistry. That was a long time ago. And I can barely follow you, Bob, but enough that I can now think about this. And so in the context of this particular picture that you've just painted, when you have GST-M1 or GSTT1 deletion, and you then become impaired, let's say, in terms of glutathione utilization, then you literally don't have any way to get rid of those toxicants that you are being impaired by.
Absolutely.
So then you're really tanked.
Yeah, you are. Yeah.
Yeah.
Yeah, you really are. And that's why I came up with what I'm calling the Holmes hypothesis: toxic environmental factors that we were not exposed to historically, amplified in those with genetic predispositions, cause overstimulation of the NADPH oxidase enzyme. As we just discussed, that makes superoxide, peroxynitrite, mast cells, histamine, and glutamate. Then the NOx enzyme makes free radicals in the NADPH steel. Then you don't support your phase 1 detox, produce nitric oxide, recycle your antioxidants such as glutathione. Then they stimulate renin, angiotensin 1, 2, aldosterone, IL-6, and NOx in a positive feedback loop, creating a self-perpetuating vicious cycle of inflammation that I've named the Holmes cycle. This was a relative of mine that I highly respected, so did in honor of him. Died in 2002. So that's what I'm calling the Holmes cycle, and here's what it looks like. Very similar here, except that we're showing the SNPs over here, the genetic mutations that could be a problem, and then how NOx gets upregulated, superoxide, hydrogen peroxide, mast cells. Here's your mycotoxins and EMF, stimulating the cytokines, the histamine, coming back, and just one merry-go-round here that just keeps on going and going. And when you start looking at this, you can see many of these people that are chronically ill have this problem, and they just can't seem to get off of it. And when you find the perpetrator, which could be sulfites, dopamine, homocysteine, upregulated mTOR, particulates, glutamate, excess iron, oxalates, histamine, it could be numerous things here that could be upregulating it. When you take care of that, calm down the mast cells, calm down the histamine, they get off the merry-go-round.
And I would just throw in there are other metals, now that we live in the age of so many body parts that can be replaced surgically. We have patients who have a variety of metals in their bodies, everything from palladium to platinum to titanium to gold and silver, all of which can, through a hypersensitivity reaction, support the production of histamine and mast cells as well, right?
Absolutely.
So that is common.
Mm-hmm.
That's really common, becoming more and more common.
Absolutely. And then here on this chart, I show the histidine potentially being upregulated, taking your histidine foods into histamine, and then consequently, wearing out your adrenals in a desperate attempt to make all that cortisol.
Right.
And then you don't have enough cortisone, and then you're just inflamed. So here's the product called Histidine that is designed to support the adrenals with some adrenal concentrate. And most people are familiar with these. I won't read the ingredients, but supports the reduction of histamine and the adrenals. DAO support, really impressed with this one. Iodine, copper, black cumin, pine bark, green tea to calm down histidine decarboxylates, and then 800 milligrams of porcine kidney for the DAO. So there's a lot of DAO products out there, but I think this is the first one that tries to also slow down the histidine decarboxylase. Aldosteroes, all the nutrients that have been clinically shown to support ACE2. And when we showed you earlier that if ACE2 is not doing its job, angiotensin 1 and 2 don't turn into the anti-inflammatory angiotensin 1-7, and we don't break down bradykinin.
Right, and just to be clear, for those that might need this explanation, you're not going to increase risk for COVID by increasing the ability of the ACE2 receptor or the ACE2 enzyme to work.
Yes. Well, I don't know that it's going to increase or decrease your chance of getting COVID, but more than likely, if you support ACE2 that might be weakened by COVID, I would say there's the potential that you'd lessen the risk of the interleukin-6 cytokine storm.
Yes, yes, that's what I was intimating, is that it's
Right.
beneficial effect rather than increasing risk effect.
Yes. If somebody sends a blank email to webinars@tolhealth.com, we'll put on there the webinar on that we just did on EMF. Plus, we'll give you the slides to this one, and a webinar on how to take the steps to find the genetic weakness, and then also a link with Dr. Jill Carnahan. So just send an email to webinars@tolhealth.com. It's an automatic response, and you'll get all that information.
And I can't say enough about the webinar on EMF. It's a definite must, as well as the IL-6 conversation with Jill Carnahan. That was enlightening.
Oh, you saw that one?
Yes, I did.
Yeah. Okay. Now, if somebody is brave of heart and wants to say, you know what, I want to dig deep, this is for the serious practitioner. This is not a genetic report that gives you a 2-page, pill for the ill, do this. This is for the person who really wants to study, really wants to get into it. So I created the Nutrigenetic Research Institute to do online education, live conferences. Then functional genomic analysis is the cloud-based software. I've now hit the $2.2 million point of investing into this software, and I'll likely be at $3 million by the end of 2022. Your genomic resource is the genetic test that we created. We used to use 23andMe, but when they came out with their version 5, they just took out so many important SNPs.
No, it really ruined it.
Yeah. Well, I'm sure it gave better ancestry and maybe more information to the pharmaceuticals, but for functional genomics, a lot was taken out. But, all things happen for good sometimes. So with all the concern there, I created my own genetic test called Your Genomic Resource, 200,000 SNPs. We guarantee we're never going to share it, change your name, whatever you want to do. And then we created with personalized nutrients, the functional genomic nutrition. So if somebody really wants to dig in and, get answers that they couldn't get before, and I must say the satisfaction that I have when somebody says, Bob, nobody else ever figured me out before, that's priceless. And it's, as I often say, well, it's because we're looking under the hood. We're seeing where it's at. The online certification, nutrigenicresearch.talentlms.com. First 3 modules are free. And also in that webinar, webinars@tolhealth.com, we give the link to that if you can't write this down too quickly. And again, it's a customized DNA test providing 200,000 SNPs. We look at all the pathways, and this is what your patient gets. Just a little box here, a little saliva collection. And we partnered with Affymetrix Thermo Fisher for our chip design, and Rutgers is our lab fulfillment center, and 200,000 SNPs, really trying to keep the price down, $199. I know some tests are really expensive. We may increase it first quarter to $225 or something like that, but still very inexpensive. And then the software is a cloud-based software program exclusively for healthcare professionals. This is not to the public. This isn't like Genetic Genie or anything. This is just for doctors. And we base it on what we call the pyramid. These bottom rows are related to ways that we can make more inflammation. As we said, Fenton reaction, Nasan coupling, glutamate, electrical sensitivity. The second row is your antioxidants. So when you click on here, you see all the SNPs that might create Fenton reaction. Click on here, you might see where there might be impediments to your NADPH. Click on here, you'll see where there might be impediments to your glutathione, and more importantly, what to do about it. So here is that interactive map that I already showed you. This is the one for IL-6. And when you click, it opens up and shows specifically how many SNPs there are. Then one of the things we're really getting excited about is that by working with personalized nutrients, for example, here's the product on EMF. When you use this software, it is tied directly to personalized nutrients. And if you want, you can make a supplement for the individual that's for them. And you can then use your cursor to take these quantities up or down. Here you can see I took magnesium taurate up to 75, rosemary acid up to, or rosemary extract up to 50, selenium up to 35. Coming soon, probably in the next couple of months, there'll be another column over here that will give you a suggestion that based upon labs, symptoms, or SNPs, you may want to consider increasing or decreasing that. You know, say for example, in the one with quercetin, if they have a lot of COMT SNPs, it may say, you know what, you may want to reduce this significantly or taking it out because quercetin can inhibit COMT. In the formulas with clove, if someone has a lot of histamine, you may want to suggest taking the cloves out or reducing it significantly because they may interact inappropriately. Here, if someone has a lot of the EMF, the calcium voltage channel SNPs, maybe you want to increase cat's claw, which is a natural calcium channel blocker. If they would have a lot of SNPs on catalase, it might suggest to take that one out. If there's a lot of SNPs on SOD, it may suggest you take that one out. So you can then make this, send it to Personalized Nutrients, they'll make it and send it to your patient. And I think this is the direction we have to go to actually get personalized. So you can just buy EMF Protect from Functional Genomic Analysis. You can private label it, or you can actually get in there and increase or decrease the quantities. And then if you have another product you want to add to this, you can put them all together into one bottle. So the person gets one bottle. And I think this is where we have to go because so many people have sensitivities. And the other concern is, and I'm sure you've seen this as well, Dr. Patrick, people bring in their supplements that they're taking, and it's like, oh, you're getting methylfolate here, here, and here, and they never bothered to add them up. When you take supplements and make the one custom formula, this software defaults to the amount that's highest in the way, whichever one product has the highest amount, it defaults to that.
So in other words, if you are formulating 4 different products, you'll be able to see what the totals are in the products, or do you just mean in each product?
No, when you put 4 of these together and say, I want to put EMF Protect, Histidine, something else together, and if we have time, I can actually demonstrate it quickly for you. It will then make one bottle that has that, but it will default, if the same ingredient is in both formulas, it won't add them up. It will default to the one that has the highest amount. Because that happens all the time. People come in and it's like, look what you're doing. And they're like, uh-oh, I didn't realize I do that. I've often said, I think I help people the most sometimes by taking them off things.
Yeah, I hear you. Absolutely.
Yeah, because they can over supplement. So the software has reports for the patient and the health professional, the pyramid with the drop downs of the SNPs, pie charts, bell curves, and we're going to be having the enzymes change colors based upon how many mutations there are. So we give guidance on the supplements, private label it, custom make it, hints as to what to increase, decrease, or eliminate. So if you'd like to take the online course, there's the website, nutrigenicresearch.talentlms.com. No charge until you take the first 3 to decide if it's for you, because I don't want anybody to take this and say, this is too complex, I'm not doing this. Because I'll be honest, this is not for the faint of heart. This is for the person who wants to be serious. And just go to functionalgenomicanalysis.com, request a free trial. If you have an older 23andMe, you get to upload that for free. Or an older 23andMe that we advise you use, $25, $199 for the YGR. The buccal swab goes to Brooks at Rutgers, sent to the online software. If you want, the patient can enter a symptom survey and you can manually enter an O test. And there's only a $25 monthly license fee for the software. Now, if someone wants to contact us, oops, this little guy went awry on us here. But Functional Genomic Analysis, there's the website, functionalgenomicanalysis.com. Or contact Yvonne Lucchese, there's her number, 717-466-5700. Her email is yvonneL@dnasupplementation.com. Or send an email to webinars@tolhealth.com, where we'll give you all of the links. And if you're interested in personalizing any of these, we can get you in touch with the good folks at Personalized Nutrients. Put your own label on it. So there we go. That's the end of the presentation.
I think that is an adequate amount of information for us to chew, digest, and absorb in the next couple of weeks.
Yes.
That was great, Bob. And I just want to thank you for your diligence, your brilliance, and also being willing to go where no man or woman has gone before. Really, I mean, it is amazing. I learn something new every single time I listen to you, and I've listened to you quite a bit, and I can see that you are evolving in your thinking, and that's wonderful.
Yeah, I tell my staff that every year I want to look back at the previous year and say, oh, wasn't that quaint?
We know so much more than we did then. Yeah,
Yes,
I hear
exactly.
you. I know. And that's the thing about environmental medicine is I'm doing a podcast where I'm reviewing articles, and I'm 400 articles behind. I just looked at my article library, and I can't do the podcast fast enough because the incredible amount of information that's coming out globally now on toxicant exposure and treatment is amazing. I need a staff, and I need to do a podcast every day, to catch up, which I'm not going to do.
Sure. One of my favorite sayings is the more we learn, the more we realize we don't know a thing.
Yeah, I totally agree with you. However, you have put together some really important pieces here. And here's what I'm looking forward to is presenting cases, an actual case, toxicant exposure, SNPs, treatment, management, those 4 pieces. So I think that's our next area to dig into is really presenting a bunch of cases. And maybe we can present one in April. I think that would be outstanding.
Okay, that might be a little soon, but
Well, I have some students in my clinical environmental medicine training course who are students of yours as well. And part of their training process to get certified is they have to present cases. So I have a feeling that it's already happened. That the doctors have already done the tests. We just need to present them. So I'm
nice.
going to get going on that.
Well, put me in touch with those people, and we'll try to make it happen as quick as we can.
Yes, I'm actually meeting with them tomorrow, so I'm going to suggest it right away. It's been a pleasure. It's been an honor, and I can't wait until we get to meet again.
Okay, looking forward.